I'm Tim Gladall, and I'm 48 years old. I currently live in Healdsburg, California. I was managing the back office of a retinal group. I do many things. I make vinegar, pair cookies with wine. I think the biggest interest I have is my children. It's whatever they want to do, and I get to be there for them. I was diagnosed with stage 4 metastatic melanoma on December 23rd, 2015. I started having elbow pain after a long summer at the lake with the kids and a lot of overexertion. And the pain in my left elbow never went away. We jumped on the path of finding out what was wrong. The day that the doctor gave us the diagnosis, I thought I knew exactly what that meant. And that meant I had a year to live. I remember the drive home was hard. We had 3 days where we had our breakdowns and we had our talks and our plans, and then we said enough, let's get to work. There was a girl at the clinic who had had cancer. And I said, who do you recommend? And she said, Ian Anderson at St. Joseph's Health. And I said, okay, that's good enough for me.
I met Tim after he had been diagnosed, so he had had some scans that demonstrated that the cancer had already spread to some bones, to the skin, lymph nodes, and to the lungs. Other than his elbow pain, he was in good shape and he wasn't overwhelmed by the diagnosis, but understood how serious it was.
He explained that there was a new drug that was recently available and that it would work well for me. I didn't quite know what work well for me meant.
There was a new immune therapy that hadn't yet been approved in his situation, and we worked hard to get that for him.
And Dr. Anderson was very clear. He said, if you can wait, we will get this drug and it will work. And the moment approval came in, I was in the infusion center 2 hours after getting the call and had my first infusion, and the drug worked. The drug I ended up on, and the one that he preferred, has a low toxicity, and the only side effect it really is fatigue. Having been a caregiver for most of my adult life, the biggest thing, and it's something I always tried to practice, was remember the patient's name. And Diane at the front desk remembered my first name the second time I came in and hasn't forgotten since. And I think that's the best indicator of how you're going to be treated.
What Tim voiced is a common thing we hear, and it really is a credit to the dedication of the staff, because it really is an outstanding group. I think one of the advantages of our system is that we're big enough to manage almost all different cancers, but we're small enough that it can really be personal. We're able to spend the time and focus on taking care of each individual person and figure out what they need.
I'll never forget the staff always remembering my name. Thank you.
I will never forget Tim's bravery and his ability to face this disease head on with a great attitude.
There are really two camps when somebody's diagnosed with something like I have, and it's either they surrender and they buy the sweatpants and they pull them on and they curl up on the couch and that's the end of their story, or they fight. I'm not going to buy sweatpants. I'm a fighter.